for joining me tonight. I do appreciate you coming out and giving me some of your time. I want to ask you before we get started, what do you know about the healthcare industry? When you think about professions in the healthcare industry, what comes to mind?
Sick people.
Sick people. What
Physicians.
roles comes? Physicians.
Nurses.
Nurses and physicians, right? Okay, well, what if I told you that an accountant, a business manager, a food service worker, what if I told you that all of those jobs had an important role in healthcare? Would you believe me?
Absolutely.
Okay, I'm glad that you can believe that and know that there is some truth to that, because actually you don't have to have a license, you don't have to have a medical degree to actually play an important role in healthcare. The purpose of this presentation is to inform you guys about the various contributing roles in healthcare. This is a presentation for a business speech communication class that I am doing with Dr. Rachel Dubois. So now, like I've said, you don't have to be a physician or a nurse or have a licensed degree to be in healthcare. Did you know that there are well over 800 detailed occupations with contributing roles in healthcare? I bet you didn't know that.
No, I did not know
Okay,
that.
there absolutely is. There is, roles in pharmacy. There's roles outside in research. There's roles in the school systems. There's roles in food service workers, dietitians, nutritionists. All of those roles play an important value in healthcare. Take the clinical front office staff, for example. There's a secretary that triages calls. She's not particularly taking care of patients, but she is playing an important role in healthcare. Her job is to answer the phones and make sure that the patients are routed to the appropriate persons that need be. The medical assistants in the back office, they prep the patients prior to them seeing the physicians. That is an important role in itself. The physicians, they have a busy job. What they need to hone in and focus on is the patient once they come into the room. They don't need to have equipment to get ready. They don't need to prep the patient and do vital signs. There is an important role for all of that, which is the medical assistant. All of those roles play a key factor. Now, the second point that I want to make is that roles that don't require a clinical setting. Take a finance manager, for instance. A finance manager is one who's going to make sure that business is ran properly, that your budget stays in place. He will make sure that you're able to bring on new staff if need be. The budget is there for medical equipment if need be. What about the pharmaceutical reps? Those reps are responsible for bringing in newly marketed drugs for the doctors to test on the patients for drug treatment. What about the research scientists? Their role is to experiment on the lab animals to make sure that the best treatment and the response rate is good prior to that medication being administered to the patients. According to the Bureau of Labor Statistics, healthcare occupations and industries are expected to have the highest growth rate in jobs from 2014 to 2024. So you may want to consider when you're looking at a career change or advancement, maybe going into the health industry. According to NASARecruitment.com, personal care aides such as registered nurses are projected to gain the largest number of jobs. Okay. So in conclusion, healthcare occupations continue to dominate at a rapid rate. If this is something that you're interested in, if you're a person looking for a long-term career in a rewarding field with job security, then a job in one of the sectors in healthcare would probably be the best for you. Okay? Thank you for your time. I appreciate it. Thank you.